Hi, my name is Vanessa Vasquez, and today I will be talking about the effects of cocaine use. First, I will be talking about the pharmacological considerations. Cocaine is typically sold on the street as a fine white crystalline powder that is usually diluted with inactive substances like cornstarch, talcum powder, or sugar. A line of cocaine contains approximately 50 milligrams of cocaine hydrochloride, which I'll talk about in detail a little later. Users typically combine cocaine with other stimulants like marijuana, alcohol, and cigarettes, as cocaine is rarely used in isolation. Marijuana alleviates the psychophysiological effects, whereas alcohol prolongs the feelings of euphoria and forms cocaethylene that has a half-life of about 150 minutes. So alcohol actually makes the effects of cocaine last longer. Cigarettes maximizes the uptake and onset of cocaine in addition to marijuana. According to Valco, cocaine use ranges from occasional to repeated or compulsive use, with a variety of patterns between these extremes. Cocaine comes in a few different forms. The main forms are the coca leaf, free base cocaine, which is a paste, cocaine hydrochloride, which is a powder, and crack cocaine, which comes in rock form. The leaves can be chewed directly, rolled into cigarettes or cigars, or infused in liquid and consumed like a tea. Cocaine paste can be burned and inhaled. Cocaine hydrochloride and crack cocaine are the most commonly abused forms. Cocaine in powder form is usually not pure as it is mixed with other active or inactive substances. And since the powder is soluble in water, it can be snorted, injected, or ingested. Crack cocaine derives from powdered cocaine after a mixture is made and boiled to create a solid substance. This means that this form can be heated and snorted to produce a smokable substance. This is where the word crack originates from. It's the sound that the mixture makes when it is smoked. Here is a table that shows the routes of administration, the onset of action, the peak effects, the duration of action, and the half-life of cocaine. While the different forms of cocaine produce the same type of physiological and psychotropic effects, the onset, intensity, and duration of the effects vary depending on the method of use. In addition, the proportion that's absorbed also depends on the method of administration, as cocaine is absorbed through mucous membranes that include the nose and lungs. Intranasal use or snorting of cocaine is the most common method of administration. It enables the cocaine to be quickly absorbed into the bloodstream through nasal tissues. The drug can also be rubbed onto mucous tissues. Users apportion the cocaine into lines that contain approximately 10 to 35 milligrams of the drug. Injecting or intravenous use releases the drug directly into the bloodstream after it is dissolved in water and injected into a vein. Inhalation or smoking involves inhaling cocaine vapor or smoke into the lungs using a pipe. This is the second most effective route as it causes rapid absorption into the lungs. Any of these routes of administration can lead to acute heart or brain complications that can result in death. Now I'm going to talk about some of the physiological aspects. Cocaine is distributed within all body tissues with the highest concentrations appearing in the brain, spleen, kidneys, and lungs. Cocaine is metabolized by a type of enzyme called esterases that is present throughout the entire body. Higher levels of metabolism occur in the liver within 2 hours of administration, and the rate of metabolism varies according to plasma concentration. Cocaine is excreted through urine, but can be detected in blood and urine 24 to 36 hours after ingestion. It can also be excreted in stool, sweat, and saliva. The physiological effects vary based on the dosage. For example, low dosage levels can cause hypertension, dilated pupils, sweating, reduced appetite, reduced need for sleep, reduced lung function, and dry mouth. Increased doses can cause seizures, strokes, and respiratory arrest. And finally, chronic use causes chest pains, muscle spasms, sexual impotence, weight loss, malnutrition, and vascular disease. It can also lead to death. Psychological aspects. Factors that affect cocaine dependence are the route of administration and drug tolerance. Heavy use is related to dependency, where smokers and injectors are more likely to become dependent. Further psychological effects are based on the dosage as effects vary. Low initial doses include feelings of euphoria, a sense of well being, impaired reaction time and attention span, and impaired learning of new skills. Increased doses include feelings of anxiety, irritability, insomnia, depression, paranoia, aggressiveness, impulsivity, delusions, agitated or excited delirium, and reduced psychomotor function. And finally, chronic use produces dependence on cocaine and disturbed eating and sleeping patterns. Addiction is caused as users impulsively abuse the drug because it exhibits powerful reinforcing properties, especially as cocaine intensifies feelings of euphoria as higher doses are ingested. Now we're going to take a look at what it looks like in the brain. To the left, you can see what a normal synapse looks like, and to the right, you can see what a synapse looks like with cocaine use. So cocaine inhibits the reuptake of the neurotransmitter dopamine, which is what causes the feelings of euphoria. Long-term cocaine use can result in neurological complications like seizures, hyperthermia that is a result of increased motor activity, movement disorders that result in repetitive behaviors, and other psychotic symptoms. According to the DSM-4, a diagnosis for stimulant abuse requires meeting several criteria, including failure to fulfill major role obligations, use in physically hazardous situations, recurrent legal problems, and continued use despite social and interpersonal problems. Use of stimulants like cocaine is associated with HIV and sexual risks. HIV can be contracted through drug and sexual risk taking, which occurs with transmission through shared needles and paraphernalia. Sexual risk is increased with reported increased numbers of partners, increased frequency of unprotected intercourse, and exchange of sex for money or drugs. As a result of cocaine's addictive nature, users must find a way to fund their habit, which means that they may turn to criminal activity such as violence, theft, and prostitution. These are my references, and thank you for watching.